Hello everyone. This is a macro to demonstrate how to use an obstetric macro to document the cesarean section done under a spinal anesthetic. So to start with, you know how to select, how to find the patient. So you have to press the select button, then choose the right date and time, and all patients only if they're scheduled they'll arrive here into this list, and only if they are in the list you can click on them and press OK to open the chart. So again, it will confirm the name of the patient there, the MRN, date of birth, age, and allergy status. So it says category 1 section. So you have to confirm that and tick the box. So this is a pop-up which comes up to choose the monitors. In obstetric anesthesia, it is quite easy because you're not moving. You are in theaters all the time. So when the patient comes in, when they ask you for the monitor, you choose the monitor in theater. It will be marked. Just to choose it, click on it, press OK. That's what you should do in reality. But because no monitors are found, I will not be able to do that because it's not connected to a monitor. But that's what you should do. And then you get another pop-up for medications, any medications that need to be continued. In anesthetics, we stop all infusions, so that is most of the time this is not required. But if a patient coming for IT, if you want to continue the infusions, you can. You have to just click and press OK. But for now, we'll just cancel it. Then you get the watermark there, saying the name of the patient. Then you get the details here. No drug allergies is here. You got name, date of birth, age, MRN, procedure, and ASA is here. You can add the ASA. So let's put it as 1E and OK. And then you know where, if you have not seen the video which says familiarize yourself with the use of anesthesia solution, please see that first, because I'm not going to explain what these boxes are for this video. In this video, because that's already explained in the previous video. So see the other video saying familiarize yourself with anesthesia solution views. So here what we need to do is, as soon as the patient is in theater, you need to start the macro. Press macro, go into the pink obstetric bed and start the obstetric macro. So all cases, including the ones under GA, need this macro. So if this macro is only to add the drugs of GA, every patient needs this macro. So you start this and I'll give you a full list of all the things. You don't need to look into it because it's all inclusive. Everything you might need is already there. So if you don't need something at any of these, in the end you'll be able to get rid of it. So if there was like an allergy to morphine or something, then it would have been coming as a highlight here to say the patient is allergic. So that's your chance to unclick it so that you don't put it in by mistake. Again, you can not add it at a later stage as well, but that's an option. So just execute immediately. The other thing you need to remember is that you need to put the blood pressure on automatic mode, whatever frequency you need, and start it on the monitor. If you put it in manual mode, the risk is going to be that you're not going to have blood pressures, and that's going to be a problem because the anesthetic chart will not have a monitor. So you don't need to do this bit, so don't worry about it. I'm trying to make some fake numbers just to show you what it will look like on the screen with the blood pressure on. So this is the box where when we put the macro in, all the bits came into this spot. This is the to-do list. It came into this. So at this point, what I do, as soon as I've started the macro and I've started the blood pressure and put it on automatic, I'll start to go and wash my hands because the blood pressures and numbers have started coming here. Then I'll go and do wash my hand, put my cannula in, wash my hand, and do everything. The documentation is all later, as soon as the macro is started, because all the numbers will be recorded, and you'll have a chance to go back to the start time and document the things. One of the things that's important in this is to remember the times that you did the spinal. Remember the time you gave the GA. That's one thing with e-care. But in obstetrics, that's not a problem because it's usually written on the board by the theatre staff. So you can always refer back and get the time. But in other instances, sometimes I've had nurses asking me what time did you start. So it's useful for you to remember that you started how many minutes past what did you start, and then remember that in your mind so that you can put that in the anesthetic chart. So while I'm waiting to give it a bit of a realistic feeling, so at this time I'm washing my hands, then I'll come back and give the spinal, and then make sure the spinal is working, and the documentation will all be after that. So until then I don't want to do anything, just to give you a bit of a realistic feel. So once the spinal is in, the patient is stable, you can wait until the baby is born if that's what you normally do. As long as the macros are started, all the numbers must be there. So once you're in a happy position where you're happy to document things, that's when you come here and start documenting things. So go on to the to-do list, and then right click on the monitors and then edit. And then this comes. Once you're familiar with what all you normally do, it shouldn't take too long. I know that I click these 5 boxes. I don't routinely write where I put the blood pressure cuff up, but if you want to write it, you can. And the temperature as well, if it's nasopharyngeal, you can. I don't routinely do that because that's what we always do. That's why I don't routinely do. So the time here, let's put it as we can move the time by left. Keep the left, browse over the time, keep the left button clicked, keep it pressed, and then move it left or right as you want to. Also, you can change it here. You can enter the time, or you can enter the time, or you can go up and down. So those are the 3 different ways of changing the time on this. So press execute. Don't press OK. You press execute always, so that it goes into the anesthetic chart. So take the second one, right click, edit. And here some of the bits have already been filled up because I usually put the candle on the left side hand and 18 gauge. If it's different, like I put 16 gauge, I can click on that, and the rest of the bits are already done. The other bit I have to do is to say that I flush the candula. Again, choose the right time when you gave it. Like if it's 17.6, put 76 and put execute. Sodium citrate is there. You didn't use it, you don't have to put it in. But if it's mostly for GAs, we use it. So with the plasma light, I won't be able to show, open by right clicking and editing, but I won't be able to show you how it is done because this is a laptop screen, and it won't come fully. So but this is what you do. You press the infusion button, and in the bottom here, which you can't see because it's a laptop, you have to put the rate you put it, or you put the volume, and then just click execute. But you can't do that in this because it is laptop I'm showing you from. So with the antibiotics, this patient is not allergic to anything. So I guess normally we gave cefuroxime. It's already filled up. Just need to hover over the ball which shows the time, and then keep the left button clicked. Keep it pressed, and then move it to the time you gave it. Let's assume you gave it at 17:06. And then press execute. The route is correct, intravenous, so execute. And then clindamycin is only if they are penicillin allergic. We don't usually use that otherwise. So don't worry about the bits that are there which you're not using. You can get rid of it at the end. So again, edit position. With the position, if something is more important, like the patient had a neck injury and you want to document it's neutral, that's fine. But once we start getting used to it, you'll know the common things you use. Once you're familiar with what is there and where they are, it'll become really easy, because I usually go bed safety strap, either wedge or tilt, whichever you use. I'm using wedge, but tilt is there as well if you want to use that. Then the other things is heels free of pressure, because we put that jelly things to support. And there is a place to write comment. So you click on that and write whatever you write will come over here. And again, the time. Anything you do, you have to just drag the time to the time you did it. So that's fine, and execute. And then the next bit is the spinal bit. So let's assume we gave it at 17.9. So right click on it, edit. And again, once you get used to what all is there, it becomes really easy. So I go awake, universal precautions, surgical hands, scrub, cap, gloves, gown, mask, drapes, chlorhexidine, and wait for it to dry. Sitting position, chlorhexidine for skin, midline, L3, Pro, 24 gauge, 9, 1. If you had any numbness, we can document it in detail if you want, or just click here to start with and then document it in detail. Let's assume we didn't have any problems. So you click none, and then you have to remember to change the time, which is 17:09. So choose that time. Again, hover over it, left button, keep it pressed and move it and execute. And with the spinal, you have to do three things. One is you have to do the documentation for the spinal procedure. Then you have to document the drugs, which are the bupivacaine and morphine. So there are two of them. And then you have to document the block assessment to make sure the block is working. So those are the three things you have to remember. So with the bupivacaine, just right click and then it's a volume only administration. So all you need to do is put the volume. I'm going to write 2.6 ml and it gives here intraspinal. And then I'll drag this ball to the time we gave it. That's 17:09 and execute. And then let's assume we gave diamorphine. So right click on it, edit diamorphine, and 0.3 is automatically there. Intrathecal is automatically there. Just have to drag it to 17:09 and press execute. And the next bit is the spinal bits are all together. The spinal documentation, the spinal medicines were together. We have used all of them. But in another case, if you're using an epidural or CSE and you are not using the spinal bits, you ignore those and use the epidural, but start with the epidural button. And these two buttons for documenting these three buttons for documenting the medicine. But the block assessment will be the same. So there is a free text box as well if you want to write something. Just like for the phenylephrine, just because I'm using a laptop, I won't be able to show you an infusion, but it's the same. You just right click, edit for phenylephrine. I usually write 20 ml per hour. If you put it as, if you change the button from bolus to infusion, and then it gives you an option of putting 20 ml per hour here, and then you'll be able to change it if you need to and execute. Once you do the execute button, which I won't be able to do because it's a small screen because of a laptop, it'll come here and then you'll be able to edit it. But for now I won't be doing it because I won't be able to show you that because it's a laptop. The next button, we need to, if you use phenylephrine, if you use glycopyrrolate, you can document that as well. But block assessment is really important. So you have to right click on the block assessment. And then you have to say where you performed it theaters or wherever you performed it. Then whatever you use, I use ethyl chloride, but if you use ice, you can click that. And then the upper level for the block is T4. That's what I got. And then you have to move the cursor a bit this way so that I can mark the lower level is S5. And then move it back here. And then if there is full motor weakness, and I put cannot move. And then if there is pain during surgery, then you'll have to document more detailed comments, but normally it's no. And then you change the time. You can just change it here as well if you want. And then that's easy. And then execute. Then surgery start and surgical incision are two things I do not routinely document, but if you want to document, you just have to right click it, put the details in. And then the baby delivery time I usually document. So the baby delivery time, you just right click on the baby delivery time. Let's assume the baby was born 11 minutes past. So you click on here, make it 11. And then if you want to write some comment, you can. Baby boy or whatever you want to write, you can. But it's whatever you want normally document. So in this macro, there are baby 1 and baby 2. But if you have 3 babies, then you can always go into the documentation. And then if you go into actions, anything that is there you can find here. So there is up till baby 4 in the documentation bit. So all the macro is only to help you find all the things you use together commonly. But if there is something which you don't usually use, you can always find it from the documentation list. That is this button here. And we go back to the to-do list. So regarding all the medications uses utrotronics, they're already there. I usually use Cinto, so I usually put the time, right click, edit, and usually put the time as just after the delivery of the baby. So you just need to move this cursor a bit to the time we gave it. Let's say 17:10 and execute. One thing to remember is that you cannot prescribe an infusion that will carry on beyond the anesthetic stop time in this. So what you need to do is you need to the oxytocin infusion needs to be prescribed on the power chart. So at this time and all things, if you have to prescribe anything else from this, you can. Eye protection is mainly for eye protection is mainly for GA cases. I won't go into that. The next bit is a thermoregulation. So again, right click and edit, and warm fluids already clicked, but if you use warm forced air warmer or anything, you can put that in. So I'll write 05 approximately, then we started that and execute. So while we have some time and the surgeons are still operating, is a time for us to go to the patient records. Click on that button, click on the patient record, and then it opens up the power chart. This button is because it's a build domain, it's asking you that. So normally it won't ask you that. So you go on to the power chart. Don't worry about this monitor because these numbers here are there on your monitor screen, so you can see them. So don't worry about them. For a short period, you may not be able to see the anesthesia solution, but your numbers are there on the screen. So don't worry about that. So this automatically opens the patient's record directly. So that's when you confirm again that's the right patient, and then go on to allergies just to make sure there is no allergies and make sure it's documented. And then I go into the drug chart to see what is already prescribed. If something is already prescribed, I don't want to prescribe it again. So then I go into request care plan, and then I'm sure you all know these bets, but if there are any new doctors who've joined, they may not. So you press the add button, and in the search box you put the word POST, post, and then a PISA thing will come. Choose the adult plan, and you got a few of them, and from out of that you have to choose the obstetric ERP. To choose the obstetric ERP, the easiest way to do it is if you click on the order now for the generic and go on to do not order and go into the ERP and put order now and press OK, and then this window will open up. I'm sure you all are familiar with that. The oxytocin infusion, we have to start here and sign for it here. So I click on all the medicines we normally prescribe, which is not changed, which is the same as it was before. Whatever you normally prescribe. The cefuroxime, you don't need to put it in here, and the diclofenac because it's there in the macro. So it will eventually be removed. If you want to write some fluid for later, you prescribe that. It will eventually be removed, but remember not to put them in here. And then orders for signature. And again, this is because it's a built domain, it will ask me lots of questions, more than the usual when we are live, but don't worry about it. So since morphine is not available, so don't worry about it, and it won't do that in the normal when you're live. So again, when I sign, it's going to ask me for the details of the boxes that are cross blue. It's asking how long do you want the fluid for. So I'll write 8 hourly, and then it'll ask me again with the same thing. It's going to ask me again. So right here 8 hours and sign, and then wait for it to upload. All this while the other anesthesia solution is still running. You're not losing any numbers, so don't worry about it. It's all working fine. You can see the numbers on the monitor, so we are keeping an eye on the patient while we're doing that. And then you have to refresh anything in power chart. You refresh immediately. So remember not to prescribe the cefuroxime and the diclofenac because it's being prescribed through the macro. And then you go to the drug chart and then refresh it. And then here if you started the Synto infusion, this is a time to prescribe it. I can't do it now because we need 2 people to do that. So get the ODP or someone who's got prescribing rights to witness with you when you're prescribing to start. So you should start it here, because if you start it in the anesthesia solution, when the anesthesia solution stops, the infusion will stop. That's why we're doing it here. And the quick thing we need to do with all patients from now on is the S-bar handover. For that you have to go to the surgery workflow. That's the bottom left. It won't be there now because it's not one of the things that's there until we go live in phase C. So it will appear then. And then if you see here, forms, it says S-bar handover. Just click on it. So it'll be a lot more faster because it's I'm accessing it from a remote location. So the procedure performed and all the other, most of the details here will automatically come through. That is a good thing about this. The only thing I need to press in this one is spinal. Everything else will be automatically coming through. All the details, everything will come through. There's no medical problems for this patient. Then there are three pages to fill up in this. In the first page, the only thing I did was a spinal. And once you're familiar with the layout of things will get a lot more easier. And this is a guideline that you mark that the peripheral cannula is flushed. If you have entered any blood loss or anything, it will automatically come through here. So that's the second thing I filled up. Three boxes I filled up so far. And the third box, I just marked the patient was stable. If you have any instructions for recovery, this is where you type it in. And then scroll down. We got few bits here. Where you want the patient to go will be a ward. Patient has own airway and ECG, NIBP, and SpO2. If you want the patient to have oxygen, you click here, which you don't usually do. But if you want full blood counts or something, this is where you fill up. And then you can fill up your bleep number here. And then the tick is on the left top corner. That's where you tick it. So that's it. All our power chart paperwork is done. Once it's updated, then normally what I do is I close this because I don't want to make a mistake of going back into it when our next patient comes and prescribing in the wrong patient. So normally I just close it and then go back into the anesthetic chart and finish off what you need to do here. So now it's the end of the procedure. The emergence is for a GA case, so you don't need to do anything. The estimated blood loss, you have to right click, edit, and then you can either put incremental blood loss, you can put 100 ml 3 times, or it's easier just to put 300 altogether and execute. The urinary output, again, if you want, you can put surgical output. There is also other, if you go into the documentation, there are other places you can document for gastric output and other outputs as well. So if you gave diclofenac at the end, I'll probably prescribe it using this rather than use power chart because we got it all in one place now. So suppository, if you gave it around that time, press execute. And then if you used any of these, you have to right click and prescribe it. So that's how you do this. And now normally what I do is I do close the anesthetic chart. The other thing, if you gave is like if you gave something let's see, if you gave like metronidazole or something, then you go on to this. You can go to the medications and then go into vasopressors, and then you can find your metronidazole, and then in this bit you just double click and it opens the box, and then you put like you gave 1 ml and then okay. That's just to show you how that is done. So it comes as a box here. Once it's open, if you give more doses, you can just click here and add more doses of metronidazole. So at this stage, just to show you the anesthetic chart, I'll go back. I wouldn't be opening it again in normal practice. It's only to show you the anesthetic chart. Whether it'll open up in time, I'm not sure. If it opens up, I'll show you. If it's taking too long, I may not wait for it. So then what you do is when it's all done, you've done all your documentation, you're happy, then you go into finalize anesthetic chart. All the other buttons like has been explained, like how to add staff, how to hand over. That's the change user button. And all that has been explained in the familiarize views with anesthesia solution tab. So that'll you can view that separately and make sure you do that before. And when I go press the finalize button, now it's telling me that it's going to stop the monitoring, and that's fine because we're going to go into another monitoring and recovery. So this is where it tells you all the bits that were there that you have not utilized. So what I normally do is I check to make sure that these are things I didn't mean to document, which I forgot. So these are things I didn't use it, so I don't have to. Then if you're sure you don't need any of it, press the ignore all button, and then you have to sign for the anesthetic chart. That's where you put your details in, which will be given to you, and your password. And OK. And then you finalize. Does take a bit of time, but where it will come in the power chart is if you go again all the way down and the workflow. We just start scrolling down a bit. This is where it'll come when it's ready. Take a few minutes. I don't want to keep you waiting, but eventually it'll come here. That's where it'll come. It does take a few minutes for it to come. Thank you very much for listening, and I hope this helps you. Thank you very much. Bye.